compared to, adjusting an adult, you see changes really, really quickly with a baby. So that was very eye-opening. And I guess that's what drove me to then go and do the extra pediatric training, was because I was like, okay, this is really what I want to do now. And I don't know, you just feel so great knowing that you've helped a little baby and that with adults, you're often cleaning up the mess of what's happened over the years. Whereas if you can help a little baby, early days, then you're creating a great change in their trajectory of life, I guess you could say.
Hello, everybody, and welcome to another episode of the Informed Chiropractor. This is Dr. Don MacDonald, your host, and today I'm going back to Australia. I've been zigzagging all over the world, and I'm loving it. And so I get to see a young chiropractor who's just a young whippersnapper in practice, and I always like to get kind of the perspectives of people who've been in practice for a long time, like me, and the young whippersnappers too. So I'm going to Gladstone, Queensland. It's an hour time difference from Sydney, Australia, and she'll explain where it is, but it's kind of a little bit remote of an area, and she's just a graduate of Macquarie University in Sydney, and she joined this practice in 2020, and her name is Dr. Kate Finlayson. Welcome to the podcast.
Hi.
I also got to meet her for the very first time at our seminar in Sydney last year. We did the level 1 MacDonald Safety Corridor and that Team Polyvagal event. And we had some good chats over the weekend, as we like to have good social time along with that. And since then, she joined the Informed Chiropractor, and we've been chatting back and forth about using some polyvagal lens stuff on some difficult practice members. We'll probably talk a little bit about that as well, which has been pretty helpful. So welcome to the podcast.
Thank you.
This is good. So tell us a little bit about Gladstone, because it is kind of a little bit of a remote place, isn't it?
Yeah, well, we're on the coast. It's central Queensland. So Queensland is huge. We've still got like a whole, I think, 12 hours until we get to Cairns, but we're 6 hours north of Brisbane, but we're on the coast, so that always makes it nice.
Yes, and again, like I was just looking through your bio and stuff, and you like the country, and you like camping, and you like being on the beach, and it sounds like perfect for you.
Yeah, well, I grew up in a regional town in New South Wales, so used to being in a smaller town. Yeah.
Mm-hmm. So how did you become a chiropractor? How did you find out about this profession?
So I don't have some crazy inspirational story, but the way I essentially came to being a chiropractor was I always knew I wanted to help people. I left school and I went to uni and studied nursing and realized it wasn't for me. I'd never seen a chiropractor before. I was seeing an osteopath at the time, and I thought that was pretty cool, the changes I'd seen. And I'd kind of watched chiropractic videos on YouTube and stuff, and I was like, that's pretty cool. I think I want to go down this path. And that's essentially how I kind of got into it, and went to an orientation day and got into chiropractic. So it's pretty cool.
That is so funny, because that is totally a generational switch, because back in the day, no one would have watched YouTube videos about chiropractic adjusting and thought chiropractic was cool. It's so funny. I think us the old people, who usually you had to hear it in the newspaper or something because we didn't have the internet. Now when we're in practice, when practice members would come and say, I see these people getting these weird chiropractic videos, like at first we were mortified by it, but then afterwards, like, it kind of almost normalized chiropractic. And so it's kind of funny to hear the new generation of chiropractic can actually start from those crazy YouTube videos.
Yeah, it's pretty cool.
So tell me a little bit about your experience at Macquarie.
So at Macquarie, it's a 3-year bachelor and then 2 years master's. So that's 5 years of that. Uni was great. I always loved learning the biomedical side of stuff and anatomy. But there was a lot of great mentors that we had at uni, and there was a lot of research that was done at Macquarie, which was always really beneficial as well.
Well, and I'm always interested, because we always when we initially started this podcast, we called it the vitality shift, because we're always talking about how chiropractors kind of went from more that mechanistic mindset of chiropractic to more to a vitalistic, or understanding chiropractic can help more than just pain. How did you uncover the knowledge of chiropractic? And was it kind of more pain based at first, and then it moved over, or did you learn that vitalistic ideas right away?
Yeah, we didn't really learn vitalistic realistic at all. That's definitely something that I've pretty much learned since I left uni, and working with Ali as well has really, helped with all of that.
Okay, so when you're in school, was it mostly just like kind of pain based? That was kind of like the focus of chiropractic?
Yeah, I guess so. We never spoke about it much. It was kind of just like, well, this is how you kind of do diagnostic stuff, and this is how you adjust. And that was kind of all you got. I think a lot of people realize that uni, you don't get taught how to, run a business or do scheduling or anything like that. I feel like that's something that most of us learn once we actually leave uni.
Mhm. Well, and it's just about every school, right? I think they just have enough time trying to cram your information into your head so you can write your board
Yeah.
exams and get licensed, and then you get thrown to the wolves.
Yeah.
So how did you come upon this job opportunity in Gladstone? Because this is where you went right after school, though, right? Like you went
Yeah.
directly here. Yeah.
Yeah. So Ali had previously put up that she wanted a locum, which was in my final year of uni. And I remember speaking to Ben Purcell, he in Bathurst,
Oh,
where
yes.
yes, and he was like, "Oh yeah, she'd be great to work for." And I was like, "Oh, such a shame." I'm like in my last year, because I knew that she did a lot of work with pediatric patients, and that's kind of the road I wanted to go down. And then it was like early after I'd just gotten my registration, and she put up that she wanted an associate, so I just jumped on it, and I flew up and looked at the job, did a bit of a observation shift with her, and it all kind of happened from there.
And so did she work at the same time you did for a while before she went back to Perth, or
Yeah, so
was that
Ali
time?
and I, she left the start of last year, so
Oh yeah, oh
we
yeah.
worked together for a good 2.5 years. Yeah.
So tell me a little bit about that, because you joined the practice in 2020. Like, was that right at
It
like
was
COVID?
2021.
Oh,
Yeah.
2021. Oh,
Yeah.
2021. So
Um,
COVID had kind of happened. So like, tell me a little bit about like, how was that?
Well, we were really lucky. Once I'd moved up here, I think it was 2 weeks later, they closed the borders because it was like kind of that second wave. So I was really lucky I got up here when I did. It was a bit rough because there was some planned trip home, but you couldn't go home. You couldn't cross the border. It was kind of a big thing. But, it wasn't too bad here. Like, compared to people at home, we could live a normal life. Yeah, you had to wear masks to work, but otherwise it was pretty normal
It
here.
was pretty, that's when you talk about the benefit about being out in the least populated areas, because it's not quite as like kind of crazy as, it's funny because when we were talking to some of our friends back like Craig and Kath Foot in Perth, at
Yeah.
the very beginning of the pandemic, we were like, oh my gosh, we're going to move to Australia because it's so good there, because nothing had got there yet, and we
Yeah.
were already shut down, because as the
Yeah.
recording right now is 5 years ago right now, we were shut down
It's crazy,
for
isn't
like
it?
8 weeks or whatever. And then after we heard what happened in there, and we're like, oh, we're never moving there. That's crazy. It was just like it was delayed. But our associate, Dr. Haley, she started like right in the pandemic too. So like
Yeah.
it was a little bit tough, because when you came in, because I think in your area, you guys are the only chiropractors, right? So in your
No,
town,
there's
or
quite a few chiropractors. We're the only pediatric chiropractors. Yeah.
okay.
Yeah.
So when you first started practice, did you have to do anything externally to get out your name out in the community, just to get kind of your practice going?
Yeah, I did a little bit. When I first started, I went to pregnancy expos because obviously that's what we focus on a lot as well. And we do them every year. There's allied health things that we go, expos, I guess, that you go to. I did a few gym talks at the gym I was going to at the time. So yeah, that was all quite beneficial. But Ali's wait list, like I think she had a 6 week wait at the time for new patients. So I was pretty lucky when
Yeah.
I started. I had people that I could see, and it was pretty good.
So tell me a little bit about that, because I know, like, did you do any extra like training in pediatrics or anything while you're at chiropractic school?
No, not at uni, but before I came up and worked for Ali, I did just some little basic pediatric courses to get me through.
Mm.
And then in 2022, I started my 2 year diplomate of chiropeds, which I finished in 23.
Oh,
So
cool.
yeah, that was pretty eye-opening. and really, really beneficial for practice as well. Yeah.
So how was your learning at the very beginning? Because I know, especially as for me as a male, coming out of school where I'm like, I'm in my like 26 or 27, and not that great around kids, and didn't really learn. I went to Palmer, and I still didn't go get that much education around adjusting kids. How was your learning curve? Like, did you kind of get a little bit mentored by Ali, or did it feel?
Yeah.
How did that go?
Yeah. She definitely mentored me through that. And if I ever got stuck, she would come in and help, which was always really handy. Yeah, I guess I had a bit of sound knowledge before I started with her, which was really helpful. But, once I was doing my diplomate, if I needed help with that, she was always there for that. So, yeah, that course was amazing. Yeah.
It's super
I
helpful.
recommend it. Yeah.
When you first started with Ali at the practice, because she had so many kids that were in there and probably had some, yeah, because in Australia, it's a little bit like Canada where we're highly regulated and we're not allowed to really say that we help with colic or digestive issues, even though sometimes miraculously go away when they aren't as subluxated. But like, how is that for a learning curve for you with not really like just knowing chiropractic through like adjusting videos and then just through school? Like, what was it kind of eye-opening? Was it for you?
Yeah, I guess it really was. And compared to, adjusting an adult, you see changes really, really quickly with a baby. So that was very eye-opening. And I guess that's what drove me to then go and do the extra pediatric training, was because I was like, okay, this is really what I want to do now. And I don't know, you just feel so great knowing that you've helped a little baby and that with adults, you're often cleaning up the mess of what's happened over the years. Whereas if you can help a little baby, early days, then, you're creating a great change in their trajectory of life, I guess you could say.
It is cool. And it's funny because it's actually, I'm thankful that Brandy worked at the front because she loves babies. And so she almost forced me to see more babies. And then over the 20 years, I got way more comfortable with that. But it's funny. I wouldn't have been as comfortable if it was just me by myself. That's for sure.
Yeah. It was definitely at the start. I was like, oh, I'm going to break them, or I couldn't stand hearing them cry. But now you're just like, oh, it's fine. Like, it's just another noise.
I remember, I think one of my very first crazy colicky babies, after that first visit, I was sweating so much just because the baby was crying. Like, it started crying at the very beginning. And the cool thing was, by the second visit, the baby already wasn't crying. Like, it was that fast that it turned around. But I just remember, I'm like, I felt bad for the mom, because I'm like, you put up with this like 24/7, like it's right. And he's like screaming like this all the time. I would lose my mind. So I was like,
Yeah.
Poor mums, poor mums. But thank goodness for chiropractic, so that's good. Now, when Ali decided to head back to Perth, and then you took over the whole show, tell me a little bit about having like kind of a sudden surge in volume, and how was that for you, and how did you deal with that?
Yeah, so the first few weeks, it was great, but it was also very, very exhausting. I was working obviously a lot more hours. I was seeing a lot more people. I started going out to a little town that's like an hour and a half away from here, called Billawheeler. So I go out there once a month now. And so I'd agreed to that before Ali decided she was leaving. And I was like, well, I can't go back on it now. I'll just do all of it. So it was quite exhausting at first. And I think too, when I met you guys in June last year at the Polyvagal seminar, I think I had been dealing with practice quite well, and I felt like I was growing a lot more without, just being the sole chiropractor in the practice. But then I realized that I was burning out a little bit. And I didn't realize that until, Brandy started talking about all the polyvagal stuff. And I was like, oh, that's me.
Well, and that's the nice thing about getting to know this early on, because it's just like I always say, when people always come in and they'll say, well, how bad is it, doc? Or how bad am I? And I'm like, well, the best way to describe it is you're driving down the road and you're starting to head to the ditch.
Yeah.
So the quicker we can recorrect before you get closer to that ditch, the better it's going to be. So it's kind of nice to be able to kind of be aware of that before you fully do burn out.
Yeah.
That's pretty cool. Which Which that brings me to the next thing is that, yeah, you came to the adjusting seminar and then the polyvagal team event. And I was just curious because I always like to see how chiropractors are taking some of the principles of the polyvagal theory to both just their life and in their adjusting. And I'm just curious, what are some of the things that you've found that were useful for practice or life for you?
Well, I feel like when I went home from that weekend and I felt like I had taken a lot to be able to actually change my life, but also introduce a lot in practice as well. So I remember like that first day and Brandy was sitting there and she was not sitting there, she was standing in front of all of us and she was saying, I'll be able to pick out by talking to you guys today who is, that dorsal vagal. And I was sitting there going, oh, it won't be me, but I'm interested to see like who it is. But then as soon as she started talking about everything, I was like, oh, okay, this is me. And then I got adjusted by you and I'd never, like I've been adjusted thousands of times and never felt that regulated, I guess, after an adjustment. And I remember walking out to go to lunch and Tally was like, oh, were you a bit upset when they said that, you were, bit dorsal vagal? And I was like, no, I think I'd accepted it because, Brandy had spoken about it and I'd realized that that was probably me. So, yeah.
That's awesome. That's so cool. And just as far as like adjusting goes, have you like did you kind of like tweak anything or use any of those principles just for like when you're
Yeah.
kind of like we always say one of the key principles in there is being a really strong co-regulator, and especially if you're dealing with a lot of kids, helping the mother help her understand the importance of her being a co-regulator and you being a good co-regulator when you're adjusting someone.
Yeah, often if mum isn't already getting adjusted, I encourage her to get adjusted as well. But big key takeaways that I use all the time now is like the zigzag pattern with the first rib. That was a huge game changer. And a lot of the polyvagal abdominal work as well, I find is really beneficial. So there are a lot of the things. Oh, and the occiput too. Like that was a game changer. I'll be able to use that as well. Yeah.
It's funny. I just had a practice member in just I think it was just yesterday, and so I just had done some visceral work on them, and they were like, when they got up, they were like, and they've been a regular patient, but I could just tell that there was something wrong. Like, because just seeing it in the face, like Randy was saying, when she saw you, she could tell just from your face that you're a little bit into that dorsal. And so sometimes when you have people who've been under care for a while and you know them and and you can just tell that something's off. So I just didn't even say anything. I just did the stomach stuff. And then they're like, well, what are you doing that for today? And I said, I just think, I always say, this is for your soul. I think you just need a little bit of an adjustment for your soul. And then they get up after and they're like, I didn't even think I had tension through my through their whole viscera. And they said, but now that it's gone, it totally feels way better. But I didn't even know it was that bad. So some of those things are pretty cool just to add on to the adjustment. I always say just to amplify that regulatory effect, right? So you feel a little bit more.
Yeah, definitely.
A little bit more chill. So I always like to ask this question. If you were to talk to your younger self when you first came out, because you've had 5 years of kind of like baptism by fire, because you kind of came right out into a busy practice. Because some people, if they go to some place, that has like a lot of other chiropractors, it's a slow grind to kind of get your practice going. But if you were to be able to go back and talk to your younger self, what kind of words of wisdom would you give yourself, even though it's only been 5 years? Or
I
4
guess
years?
I did being a lot more confident in what you know, because I think that's a big thing for most people when they come out is you're kind of thrown in the deep end and you've just got to be confident with what you know and I guess believe in yourself as well. I think a big thing for me is I often get a bit of imposter syndrome, but then you've just always got to look back and go, actually, I absolutely know all of this and I'm doing just fine. Yeah.
Mm-hmm. Yeah, it's funny because people don't give themselves enough credit. Actually, it's quite funny because when we first came out with the Vitality Shift program with all the objective testing, we had some chiropractors we worked with who thought that they weren't that good of a chiropractor, but they weren't actually doing the objective testing. And then when they started doing the objective testing on the reevaluations, they're like, holy smokes, I'm actually a pretty good chiropractor.
Yeah.
It's just that if you aren't paying attention to all the little nuances of improvements, you can go on and you can miss it. And actually the practice member goes on missing it as well, right? Because if you don't bring light to it or measure it, it's hard to be kind of cognitively aware of it, right?
Yeah,
So
definitely.
that's pretty cool. Now, I'm kind of interested in what your self-care routine's been now that you kind of took over the practice full blast. You're getting pulled where you have to, drive away and do your side clinic, plus being super busy with life and everything else with your dog and all that kind of stuff.
Yeah.
And what kind of things are you doing on a regular basis to keep you a good co-regulator for your practice members?
Yeah, so that's probably what I did struggle with the most when I became the only chiropractor in practice. I stopped kind of going to the gym because I felt like I had no time. So after the polyvagal seminar, I actually changed my hours to make sure that I could get all that in, and it's made me feel a lot better. But I do my Pilates. I take my dog Jeff for his walks, and I try and get, I'm a bit slack with it from time to time, but I try and get breath work in because I often know that that will bring me into a more of a calm state if I am a bit dysregulated as well. Yeah.
Now, coming to the end of our podcast, I always like to, one of my closing questions is a little bit of what kind of words of inspiration would you like to leave chiropractors with?
Oh gosh.
And if that's hard, because especially if someone's younger in practice, or what kind of things are inspiring to you? Because often that spreads the message.
I mean, what's been inspiring for me is always kind of having a mentor. So having Ali the last few years when I was going through uni, Ben Purcell was always there. And the first time I ever met him, I remember him saying, we were just talking and he's like, oh, do you have a problem with your jaw? And I was like, yeah, I do. And I was like, I want to be like that when I finish uni, that I can look at someone and realize that there's something wrong. So I guess, yeah, following what feels right, because you've got to have and not that you have to have a niche, but I've found that's been really beneficial for me, is knowing that I have done a lot of study in a certain area and I can absolutely thrive in that area. But I guess just watching your patients grow as well and change is probably the most exciting part of practice as well.
Yes, I think so too. It's I'm starting to feel old because I get now I have the kids that came in, the little kids, and then they start driving themselves in. Like that's I'm like
Yeah.
I'm like, how did you get here today? They're like, I drove. I'm like, what? I'm
Are you
like,
old enough to do that?
exactly. I'm like, when I first saw you, you're like a baby. You're like 3 months
Yeah.
old or 2 months old. So yeah, it's and the longer in your practice, you'll be able to see those things too, because people will be under care for longer and longer. So yeah, it's pretty inspiring. But thank you for sharing your story. I always like to get that perspective of like the 4 year out chiropractor. And I also look very much forward to seeing you in June. You're registered
Yes.
for
So excited.
coming to
Yes.
level 2 in Sydney. So we'll be super excited to dig in on that as well. So thanks very much for being on the podcast.
Yeah, that's all right. Thanks for having me.
So everybody, hope you guys are having a wonderful day. Got some good insights from I always call them the young whippersnappers in practice, which are always inspiring to us older folks. And let's talk again in a couple weeks. Have a good one.